All right. So welcome everyone. I am Francesca Velasquez and I am chair of the Captains Committee. I'm here. And what I wanted to share that this meeting, the goal of this meeting is aims to inform participants about the legislators' victories and share in the excitement and discuss how we could grow from this victory that we had in Connecticut, which is so big. Um, sorry. So our mission in child care for Connecticut's mission is to transform the child care system in Connecticut by building sustained public funding for child care to achieve our transformative vision of the equitable early childhood system that supports Connecticut's families and economy. Okay.
Hi, good evening, everyone. My name is Alyssa Romero, and I'm a part of Childcare for CT's policy support staff team. So when discussing state-supported early care systems, we've heard from Commissioner Bai say that this is the most comprehensive early childhood system in the country. Now, when we hear something like that, the question becomes, is this true? In our at a glance here, we've compared Connecticut to a few other states that have similar initiatives. Connecticut checks all the boxes in an effort to support both families and providers. We're the first state to create a permanent early childhood endowment funded by the general fund surpluses, rather than relying on volatile sources such as oil and gas, like New Mexico. We mandate wage parity with public school teachers and full health insurance subsidies for early care staff, whereas areas like DC offers one or the other, and it's not statewide. And then you have New York and New Mexico, which only have partial or pilot efforts. We have a firm 7% cap on childcare expenses, regardless of family income level. New Mexico has a 0% fee for families under 400% of the federal poverty level. However, that leaves much of the middle class vulnerable. You have areas like DC that does 10%, but even then, it's not a whole, it's not regardless of income level like Connecticut. Connecticut's endowment has a slot expansion target of about 16,000 new infant to pre-K slots by 2032. And then other states have no statewide goal or universal access. In regards to a portal, Connecticut is set to have a portal providing real-time information on available slots, including subsidized options. This is a one-stop portal, which would also allow for lawmakers to access data to analyze gaps and further support expansion. Areas like DC and New York have tools to find pre-K or subsidy programs, but they're not as integrated or inclusive in comparison. Now, we've covered a very small bit on the 0 to 5 scope, but to reiterate, Connecticut's endowment covers infants through pre-K to ensure continuity of care statewide. And finally, we have our facilities grants, where Connecticut pairs its endowment with capital and IT bonds to expand facilities and have a comprehensive one-stop parent portal. This year's legislation synthesized other models and expanded upon them to create a more evergreen, equitable, and user-friendly model. So yes, the commissioner is absolutely right in calling this the most comprehensive in the country. I personally am very excited to see how this helps families and providers across the state, and I know everyone at Childcare for CT is too.
Thank
So
you.
thank you for all that information. Okay, so let's do that. Introducing the legislators in this space, thanks them for their commitment to childcare and making this victory possible, right?
A lot of the audience members here haven't heard any of the details. So I loved how you both really tag teamed it in right before you did like a debrief for advocates before the vote was official. You did a great job tag teaming details of what both bills do. And if you can do a repeat of that so people have a little bit more in depth, that'd be great.
Sure, happy to. I'll start with SB1. Kate, what do you think? Okay.
Yeah, I think that's totally fine.
Okay. So in SB1, which just is so exciting that we passed this, it establishes the endowment, the child care endowment. And in this year and then annually, an estimated unappropriated general fund surplus will be moved into the endowment. This year, I have been told so far it's around 200 million, although that all gets trued up after the year closes and the comptroller takes a look at the monies available. For the first 2 years, the Early Childhood Education Endowment Advisory Board is authorized to disperse only 12% of the total funds. And then after that, 10% of the funds, it will be spent per year. That's to make sure that we keep the most amount of money in the childcare. Sorry. And in the endowment, but also our building infrastructure while we go. So we will be doing programmatic work, administrative work, expansion costs are coming out of there. And then from there, the funds from the early child care development will go to early child care programs, preschool programs, and then expansion of any slots shall be at least 35% for infants and toddlers. For 2028 and annually thereafter, the family contribution for child care services provided by early child care programs that receive the endowment funds will be for families making less than 100,000. They will pay nothing for childcare. Yay. Had to throw that in there. And then for families, I'm trying to go slowly. Is this too slow?
You're good.
Okay. For families making more than 100,000 annually, they will pay a maximum of up to 7% of their income. Okay, so that is just remarkable. In the child care advisory education, early child care education advisory board, their duties, membership, and reporting requirements are all set out in the bill. OEC is to every 5 years do an impact analysis so we can check in on our work and make sure we're going in the right direction, building enough childcare slots, making sure that we're funding renovations and expansions. And then just running through here real fast. And then finally, I think it's really exciting that by 2030, we will have an additional 16,000 childcare slots in Connecticut. So there's a lot to do in terms of the advisory committee, in terms of how we structure things and make sure that we're on target, in terms of advocacy to make sure that every single year we fund the endowment. That is always a big concern. But this is a transformational, oh, I forgot to mention the the provider insurance policy, providing support for providers with insurance for them and their families, which is just remarkable. And the fact that we will be making a transformational change for children because we're doing birth to 5, for providers because we are going to have wage parity with educators, and also with providers because we are going to have, OEC will bring together their administrative and training capacities to help the providers with making certain that they're getting the training they need and help move them into additional certifications. And it is just remarkable. And I want to thank every single provider, every single advocate who was out there and pushing the envelope for so many years to make this happen. And I also really want to call out Ava, because I think that you are wonderful. I mean, just wonderful in everything you've done, and everyone else that I've worked with Childcare for Connecticut. So thank you all so much, because without you, this would never have happened.
Thank you. Thank you so much. Yay.
Awesome. Thank you, thank you, Cece. And can everyone cheer for Senator Maher too? Because in her role as chair of the Children's Committee and just who she is as a person, I am so thrilled that we could be partners on this, because as we know, this is not this, as you all know here, this was not just a one-year effort, right? You all have been engaged in speaking up for yourself and your educators and your families and your kids for so many years. And none of what we're talking about tonight or what we're talking about for the future of Connecticut would be possible without you. And I know personally that I learned so much from you. And I just want you to know that everything that you share from your own lived experience really has mattered to put together this historic step for Connecticut. And as Senator Maher mentioned, there are many things that are in Senate Bill 1, but I just want to reiterate that Senate Bill 1, House Bill 5003, and another bill, the bond bill, which we'll refer to, are really the package of bills that put forward this significant childcare investment for both now and in the future. And as you can tell, we wanted to learn from all of what is working across the country to make sure that Connecticut was putting all those pieces together, and also all the pieces that you said were important to you. And that's why, as Senator Maher said, you heard several of the things that were important about bringing down family costs, and those will significantly start in a bigger way once those increases in slots happen for state-funded programs. We're seeking to support providers and educators in a bigger way. And then finally, what I'll get into here in House Bill 5003, a few other ways that we want to support everyone, in the system overall, and not necessarily just state-funded programs. Because one of the things that we get a lot of questions about is, if I'm not a state-funded program, what does this look like for me? And I think that's a really important question, and we want to make sure we're supporting the entire childcare sector. So in House Bill 5003, a few of the other items that are really important, I think, for this group is that mention of an online portal, which will be a way for families to search for care, but then in turn, a way for providers to provide more immediate info about slots that you might have available. And as things progress with this system of payment that is set up between the Office of Early Childhood and those state-funded programs, it'll actually be able to have a more significant role in making sure that those payments are happening, again, upfront for providers. So it's really meant to be a portal that can serve families and can serve providers. And it's based on a model that is used significantly in Colorado. And one of the key things that was in House Bill 5003 is that the Office of Early Childhood has to listen and speak with providers and families in the development of this portal, because your engagement in developing this is really critical for it to be useful and successful. The other things in 5003 that I want to mention that I think are particularly important for this group is the ability for there to be a pilot program for home-based providers to move from having 9 children to 11 children with an assistant teacher. And that will be a program with a pilot program with the Office of Early Childhood. And that was something that I know this group and many other folks who work with childcare providers wanted to make sure we could bring that to fruition. And that was a part of 5003 as well. And I definitely wanted to highlight that. Also, not in House Bill 5003, but it's mentioned in this slide in what's called the bond bill. There was very important dollars that will be available for application for both home-based and center-based providers to apply for facility improvements, to also potentially create new centers. And this is a commitment for 7 years of the total of $80 million in bonding. And this is significant because we've seen that this can really make a difference for many of you to make those improvements you might want to make to your current facilities, or again, where we might not have enough child cares, that we might need to invest in growing new child cares. And so that's something really important to mention. And I would just say, I've also heard, it's not mentioned on the slide, but one of the other things in House Bill 5003 that's worth noting, we definitely hear from many of you about concerns about liability insurance increases and also background check issues. And so both of those are addressed in House Bill 5003, that the Office of Early Childhood has to pursue several studies to come back to us as a legislature about how we can address those issues. And hopefully we can get some recommendations about how to best address those issues for many of you, because we know those are important for you to succeed as well. So I think those are the big highlights that, again, I think complement what Senator Mar shared. But again, I would encourage you to kind of look holistically at these bills and really see that this establishment of the Early Childhood Education Endowment is one step towards setting up this structure for the future. And it really is going to need to take all of us to maintain the focus on getting this continual investment into the endowment. Senator Mara mentioned that the bill says that there's a dedicated amount of surplus dollars. But as a legislature, every year we come in and have fights about the budget. And that's why we will be continuing to fight to make sure that these dollars are maintained. And then again, we're going to need your input to make sure that they're going towards the best uses, to make sure that we're supporting the system so that we're reducing those family costs and supporting so many of you as educators. But again, I couldn't be more grateful to be a part of this team. And it's hard to think this way, but this is really just the beginning of what we will be building together. And I am grateful for all of you, and I look forward to our continued work together. So thank you for having us, Ava and team.
Oh, thank you. Thank you so much. It really did explain a lot of stuff. So next we're going to have, is Legislator McGee and Ava on?
I'm here. I don't think Brandon's here yet. This is bedtime for his kids, and he let us know. So when he does come on, we'll
You
definitely
wanna-
yield the space, but I'll take it from here. And Alyssa, you can go to the next slide.
Okay.
Senator Mar, Representative Farrar, you guys, the feeling of love and all the positive energy is mutual. Truly, this session would have not been possible with either of you. Of course, that includes Representative Paris, who also couldn't be here tonight, would have loved to, but he had another meeting for his other job. Other than being a legislator, he has another job. So we send love and appreciation to him as well. I did want to share really quickly, I guess I guess I'll do a shout out to you guys and let you know that I'll text you all. Our advocacy team created something called a kudo board. It's like a thank you board with these emojis and messages from individuals, and I'll text individually the link to each of you so you can take some time and see the love and support from this community, and so much appreciation. Um, I think we pretty much went through the main questions. So some of the details that are in the slide deck were already reviewed, which is awesome. If Alyssa, you can take down the slides right now, we can answer some questions that are in the chat. Some of them are a little harder and the answers are not yet ready. But there are some overarching ones. So there's one that says, does this program or does this expansion include non-traditional care? Yes, non-traditional hours are included in this conversation, absolutely. Then there's a question about, Carol said, is there literature that I can read about these changes? Yes, Carol, we can send you everyone who participated on this call tonight. We could make sure that we send you the slide deck in English and in Spanish. We also have the OEC slide deck that they presented on a provider call that's a little bit more detailed but provider centered. We wanted to make sure that tonight's call was more even keel on what helps parents, what helps providers, and what the bills really create. But if you are a childcare provider and you want a little bit more nuance on how it impacts your childcare space, we'll also make sure to include the slide deck that OEC presented on our Monday call that kind of goes into that detail. Representative Farrar and Senator Mar, maybe this was a good one for you. How is the portal different from 211? What makes the portal different from any existing state program or state website?
Did I lose the senator?
Oh, she had to leave. She had
Oh,
another
okay.
meeting.
Okay,
Yeah,
thanks
she
for letting
did.
me know.
You're welcome. I'm sorry.
It's okay. It's okay. I can jump in. So
Okay.
I do think some of the functionality of 211 is a piece of what is imagined here, but I would say secondly, this is related to a functionality around some of the payment structure that will be needed between state-funded programs and OEC in order to make sure that they're being paid up front according to this structure so that families making 100K or less pay nothing. And then again, families over that wouldn't pay more than 7% in the state-funded slots. So from what we've discussed with the Office of Early Childhood, they are, again, looking at a few other states that have built a model that kind of embeds both the ability to easily find childcare and pre-K and also the ability for providers to have more of a one-stop location, because I know one of the issues we've heard from providers is that there's a multitude of databases they currently use. And so OEC is trying to combine some of those to kind of make this easier for both providers and families. But also, Ava, I know this was a priority for you all as a team. So if there's something else that I've missed that you want to comment on in regards to functionality, please do.
I think it's important to mention that the OEC has researched and talked to other states to compare what they've been doing, and there isn't like a lot of the legislation that was passed this year and the different legislations, there isn't a roadmap that's exact that we can use as an example. There's pieces that we would like that we want to mimic, but there isn't the exact perfect thing to recreate. So right now that goes into the OEC planning stage. What I could say is that as advocates, our commitment was to create something that was user-friendly, parent and provider friendly, and that wasn't just information on a screen, you read it and you walk away, that it really had an interactive approach to it, really connecting the provider with the parent and the guardian. Another question, Representative, and I'm not sure if you have the answer. I don't have the answer just yet for this one. It says, Amy says, I have a lot of educators in the field asking about when the increase in pay will take effect.
Sure.
In July, or a later date?
Sure, I can speak to that. Okay, so the way that the endowment functions, which is really important to recognize, is that it doesn't try to replicate or create a scenario where we are taking away funds from the current general fund. So in the current general fund, there are dollars and increase in rates for Care for Kids providers, right? I want to be clear about that. That's a part of the general fund budget. And Care for Kids providers are continually going to see those rate increases. That would be the goal in the general fund, okay? For the endowment, there is the focus on increasing slots with the Early Start program, right? And this year there was the opening of, more state-funded slots through Early Start. And what is going to happen is that with the current Early Start providers who are getting Early Start dollars, in the first 2 fiscal years, so and I can pull up my little chart for you all because I have this handy. So for instance, those Early Start providers in fiscal year 2026, Early Start should see a 4% increase in rates. So just like we're increasing the Care for Kids rates in the general fund, the Early Start providers for their slot should see that increase of 4% in 2026. In 2027, Early Start providers will see a 6% increase in rates, okay? But what's planned is that the dollars and the increase in rates will go up much more substantially in fiscal year 2028. It's anticipated approximately 14%. And that bigger increase in rates in fiscal year 2028 will be when the expectations will start to be there for providers receiving state, the state funds to start to meet the pay scales in the narrow cost analysis. So it's trying to build up towards this goal that in fiscal year 2028, when that request for proposals increases the slots by 16,000 more slots, that again, those dollars will increase even more for providers at that time so that we can reach more of that pay parity starting in fiscal year 2028. I hope that helps.
That was pretty clear.
Okay.
I want to acknowledge that's again some of the other questions here. We don't have answers to. So there's questions about details of what are the educational requirements for FCC in the Early Start program. What does that look like? And then questions about the implementation of Early Start. So I'm gonna hold off. Okay, last question. I'll go to Greg Melville. Last question. Greg, do you want me to read it, or do you want to go ahead and ask in live time since you're on camera?
You're muted.
Not sure which question. I asked a couple of them.
Does anyone know? Well, the time is yours, so go for whichever one you want the
So
most.
I was wondering if any media have written for the layperson a good analysis or description of the legislative material for these bills, what they contain.
I would just say I think Ava mentioned, I think that was the goal of this presentation because a lot of the media articles, they're not as comprehensive. They only cover bits and pieces. So I would encourage everyone once, again, once they capture all of this and hopefully send it out to you all again is a really good piece. But then I think it's a great point. Maybe I should write something that goes in one of these.
Wow. Yeah.
Maybe I should write something to go somewhere because a lot of the media outlets covered certain pieces, but not the full thing comprehensively, in my opinion. So it's a great point. I think this presentation could help, and I'm happy also to work on something that we could get out there.
Thank you. And I think it would be great if
Yeah.
people around the country, maybe if an op-ed got put in somewhere that would get national exposure, because I think a lot of people will be dumbfounded at what Connecticut has achieved.
Yeah, great question. And to be continued, we'll work with Rep. Farrar to make sure our talking points are accurate. She flagged something, and just in this conversation, she flagged something. So a reminder that the Office of Early Childhood, again, and I think I said it twice, there's a lot of details that are work in progress for implementation. When they are ready to talk about those details, there's going to be town halls. And we expect to be part of the town halls that they host together with other advocacy organizations to get as many people attending by region physically in those town halls, and of course doing a virtual space. This will be a little later in fall when the details have settled and they have more clarity and implementation on Early Start and FCC and all of those, the nuances of the portal are a little bit clearer. So we wanted to give you a debrief of all the work that Rep. Farrar, CC, Senator Marr, Paris, Chafee, and McGee did. That's already written down, and then we'll transition into what that looks like in live time with the Office of Early Childhood. So we're not providing any misinformation. We don't want to guide you to an answer that's not quite yet ready to share.
And Ava, if I jump in, I apologize. I just want to jump in because I see the chat. Yes, it's from 9 to 12. So thank you for clarifying that. If I said 11, in regards to the pilot program for home childcare providers to serve a maximum of 12 kids instead of 9, if OEC grants that. And I think there was a question, how will that work? That is something that the Office of Early Childhood will set up, but there will be a limited window for those providers because it's treated as a pilot. It'll be for 3 years that they'll be able to have that ability. And it'll have to align certainly with any other, number of requirements that might be needed for that residence, to continue to provide that care for health and safety. But it really will be up to the Office of Early Childhood to set that up, and they will determine the process for that.
Thank you, Rep. Farrar. All the other questions we have to hold on. We just don't have the answers, like implementation questions, but thank you for the enthusiasm. We promise we will not forget these questions. We have it on the chat. We have it recorded. We can send it over to OEC and share so they're not forgotten. We have about 18 minutes left, and we wanted to transition into next steps and what those town halls look like. And how we can still keep engaged in expanding on the wonderful work that Rep. Farrar did for 2026 and preparing ourselves for what could be some federal changes on money coming down our way. So I'll pass it to Tara. Tara, considering time, I'll leave it up to your discretion of how you want to use it. Tara is our Organizing and Strategic Outreach Director. Tara.
Okay, hi everyone. our original plan was to go into a couple of breakout rooms. And I believe Alyssa is the person who will be setting that up. I think we can do this quickly. I just need to get through 2 things first. So this summer and fall, we are planning to build our base and our partners with more people across the state by one of the things that we're doing is having tabling events. So in a few minutes, I'm going to drop a link into the chat. If you know of any like festivals or fairs or anything that families would go to, please give us that information in that form. And I want to flag something for everyone to be thinking about. So last year, our board voted on a new governance structure for the coalition, which includes the creation of a parent-heavy advisory board. The board will be 60% parents and guardians and have representation from providers and business owners. We are looking for volunteers to be part of this. So if this is something that you're interested in, please email one of us. And if you know of a parent that would like to participate in this, send them our way. Okay.
I want to thank. What I want to do is that I want to thank folks for staying on and for the good conversation. I think we got a lot from this, from the senator and the legislators, just kind of giving us the logistics or the details on the bills and what's going to cover and what we're going to do to keep this momentum for the future for 2026. And hearing from you what you need, what you want to know. All of this is going to be saved and it's going to give us more information on how to navigate this. I want to say I am proud. I am a very proud child care provider from Connecticut. Like, I'm proud to say that because what happened this legislative season was big. This was big, and our consistency is what got us here. So I want to thank everyone.